Hi, I'm Dr. Robert Davis with Active Health Complete Relief Care, and I'm here to answer the question how Trigenics can help somebody with shoulder pain or even a frozen shoulder. Trigenics is a neurological treatment system that resets the communication between your brain and the muscles around the shoulder joint. So the problem with somebody that is suffering with frozen shoulder is that they lose range of motion. So there's some general ranges of motion that they lose when they get a frozen shoulder. So let's go through some of the ranges. You're looking at a range which is external rotation. So they like to call this the I solemnly swear position. You're not able to move your shoulder in this direction. People will also have problems even washing their hair. So putting their hand over the top of their head, reaching behind their back, and even raising their arm to the side becomes very difficult. They can't get it to about this level. Some people can't even raise it this far away from their body. So how does that happen? Well, there's different reasons for frozen shoulder. One of the main reasons is you have damage to the connections. So the connection between your brain along the spinal cord and then across the nerves, there is a lesion along the pathway, meaning there's interference that can be caused by damage in the cervical spine. It can also be caused by an injury to your shoulder, and this is an injury that could have happened years ago, or it could be some type of repetitive injury that you don't even realize that you did to yourself. So when you lose that connection, it's like you have static in the lines, and that static causes a lack of communication between your brain and the muscles around the shoulder joint. So muscles in the shoulder need to do two things. They need to lengthen and they need to strengthen. So in the different movements of your shoulder, which is external rotation, internal rotation, lateral raising, and then bringing the arm towards the body, those four motions, you're talking about four different muscles. So for this external rotation, your supraspinatus muscle needs to strengthen. When you internally rotate it, it needs to lengthen, and your subscapularis needs to strengthen. For lateral bending, your deltoids are going to need to strengthen, your latissimus dorsi will need to lengthen, and vice versa when you're bringing your arm down. Well, if there's a miscommunication along the pathway, then what's happening is when the muscles are supposed to lengthen, they're strengthening. When they're supposed to lengthen, they're strengthening. What happens? Shoulder pain. You can't move your shoulder anymore. If you or a loved one are suffering with frozen shoulder, you have chronic degenerative pain in your shoulder, and you've tried the injection, you're facing shoulder replacement surgery, you're taking pain pills, please take down the phone number below. My guarantee is that I will be able to rule you in or out of care in 2 visits. That means I will be able to know whether I can help you or whether I can't help you in 2 visits, or I don't take you on as a patient. Again, take down the phone number on the screen, mention this program. It's only going to cost you $60, and we will get you into the office as soon as possible. Thank you. Hi, my name is Dr. Robert Davis with Active Health Complete Relief Care, and I'm here this morning with Sherry. Good morning, Sherry.
Good morning.
Sherry, could you please explain the problem with your shoulders and give me a little bit of the history that brought you into my office?
Sure. I was diagnosed with rheumatoid arthritis by a rheumatologist, and rheumatoid arthritis encompasses just crazy amount of body pain from my shoulders right down through my knees and my ankles. So I was having a lot of body pain anyways. I was on much medication, lots of medication that I was supposed to be taking on a daily basis, and taking all of that medication wasn't making me happy. I'm a teacher, and I didn't feel comfortable taking that while I was, doing my job. So I found out about you, Dr. Davis, through my mom. And
Mary Lou.
Mary Lou.
We love Mary Lou.
And prior to coming, my biggest complaint before coming to see Dr. Davis was my shoulders. My arthritis had gone into my shoulders to the extent that I was not able to raise my arms
I remember.
beyond my rib cage, I would say. Either arm, not even just one shoulder. When I would shower in the morning to wash my hair, I would have to bend over so that I was able to wash my hair. And it just completely interfered with so much of my daily activity. So my mom suggested that I come here, and I came and had a consultation. And Dr. Davis said, all right, let's give this a try. And within one treatment, I was able to get both of my shoulders up over my head.
Right.
And by the second treatment, it was without even any sort of hesitation.
Now, what did you try besides the pain pills? Did you try anything else to get those shoulders moving, exercise, any physical therapy? What did you attempt to try?
The only thing that I attempted to try, or that they suggested that I try, was exercise.
Okay.
But of course, it was hard to exercise when it's
Right.
hard to move your shoulders. Like I said, they had me on different types of medication, which when I took the medication, it gave me great relief. But I didn't want to have to go that route. And so really, I was lost. I didn't have an option that I was going with at the time.
Right. So if you had to tell anybody out there that is suffering with the frozen shoulder, and frozen shoulder is when the shoulders lock up, it's basically when you lose range of motion, so there's a disconnect from your brain into the muscles that are moving the shoulder. But if somebody's out there watching right now and they're suffering with frozen shoulder and they're not able to wash their hair, they can't reach their hand behind their back, they're not able to even lift their hands over their head, what would you tell them?
I would tell them, do not waste a single second. If they need to come in for a consultation, if you're not able to help them, you'll let them know. But I would do it again in a heartbeat if this occurred again, that this is what I needed to do.
And how, so when you first came in, we did an evaluation, we did a full neurological exam. And then the next visit, we did your first treatment. How soon did you know that this was the right treatment for your shoulders?
Immediately. Once we were finished, you had me stand up, and I tried raising my arms prior to the treatment, and as I said, they didn't go beyond my rib cage on either side. As soon as the treatment was over, I stood up and I was able to raise both over my head.
Awesome. Excellent. If you or a loved one are suffering with frozen shoulder and it has not been resolved with injections, with taking pain pills, or you might be even facing a shoulder replacement surgery, please take down the phone number below. Call our office. We'll set you up for an evaluation. Our normal cost is $250, but if you call our office right now, we have a special which is $60. All you have to do is mention this show. Again, take down the phone number below and give us a call. Thank you.
Palms to your side, and I want you to raise your hands your arms as high as you can go.
That's it.
That's it? Okay. All right, now I want you to raise both your arms up as high as you can go. Oh, Sherry.
Try to grab both hands.
That's one
Try
trigenics
to
maneuver.
Hold them up.
One
your fingers together.
trigenics maneuver.
Oh, I can stretch.
Try to hold them up there. I'll help you a little bit. And grab your fingers together. Yeah, just hold that. Try to straighten your elbows. You gotta just keep doing that.
Okay.
And I want you to let them come down slowly
in the mirror, I guess.
slowly
so I
to
know.
the side. Yeah, keep them straight though when you're doing that. So,
Yep. Don't bend your
wow.
elbows.
yeah, just really slow, really slow.
So Sherry, how do you feel?
Feel much better.
Okay. So how long did you have this problem?
6 months.
For 6 months? Okay. So what I'd like you to do is raise your arms, keep your palms down as you're raising your arms, and just take both arms and raise them to your side as high as you can. Okay. Can you bring the better one up a little bit higher? There you go. Just keep bringing the better one up so we can see the difference there. Okay. Okay, you can put them both down. Thank you. Good. So this is after the Trigenics. I want you to keep the palms down. Now, what's going to happen? You're not used to lifting your arm up that high, so just slowly do it, and the muscles should start engaging for you. Okay, so just take a deep breath and start raising your arms to the side. You could probably help him a little, Becky. Get that arm up there. Keep going. Keep going. That's awesome. You're getting there. You're getting there.
Keep going.
Look at that. That's freaking fantastic. That is great, Gus. Keep it up. Keep it up. Try to see if maybe you can help him a little bit now. Okay. Because he doesn't, the muscles got weak up there. Okay.
Look at that. Big old muscle.
What's that feel like?
Wild.
Okay. And you can gently let him down. Okay. And I want you to take a deep breath and go all the way up.
Woo-hoo.
And go down.
5 minutes.
So how does that make you feel?
Wonderful.
Greatly raise without turning your hands. Do both of them at the same time. Okay. And then bring the better shoulder, the one that moves better, all the way up. Okay, and then try to bring your right shoulder as high as it'll go. It's right about there. Okay. All right, you can bring it back down slowly. How long has it been like that?
About 2 years, 2.5 years now.
And
I had the surgery 3 years ago, I think.
It's been
So we've been up there 2 years now, so.
what have you tried to get better range of motion in that shoulder?
Nothing. I went back and saw a different surgeon who told me he could probably repair it, but I didn't want to do surgery again.
With surgery, did they just say orthopedic or a replacement or?
Originally, the guy told me when he did the surgery that he could help me,
Yeah.
and if it didn't work, the only thing left was shoulder replacement. Okay, this is after my third Trigenics, and this is what I could do, what I couldn't do before.
So there it is.
My name is Mary McDonald, and I came to see Dr. Davis because I've had 30 years of chronic back pain and immobility, and since I have come here, my movement, my back, everything has improved tremendously. I have full movement, very little pain, and almost no pain right now, and it's been a long time coming. I've been to chiropractors for 30 years, and I haven't seen results like this. Also, with the Bulletproof Coffee, we have had marvelous results with that. As far as my energy level, I've never had this kind of energy level in the last 25 years. I was tired every day. I'm no longer tired. My cholesterol was 160 today. When I went to my regular doctor, it was probably close to 200 before on my last checkup, and it's just amazing to me that it could come down in 1 month that I've been coming. An amazing improvement. And I've lost 12 pounds.
Good job.
My name is Chuck McDonald, and I came here originally because I saw the ad somewhere in regards to neuropathy, which we're still working on. But the bonus for me is that I could not lift my arm above my head ever because I had a frozen right shoulder. And after my third episode with the Trigenics with Dr. Davis, I'm putting my arm over my head and I'm doing things I haven't been able to do in years. And the same with the Bulletproof stuff. It's unbelievable. I can't do it without the coffee. The energy level is unbelievable. So I got nothing but good things to say about the doctor and his staff.
Yes.
Okay, so what I'd like you to do, Jerry, is just tell me how long you've had the problem with your shoulder. Just quickly tell me.
In 2 years, in
Okay.
March, I heard starting a generator, told my rotator cuff. Surgery is not a great option, no guaranteed result on the end, so I kind of did not do that. I have done physical therapy where I can now get it up like that.
Right.
That was through orthopedic specialists. They gave me exercises to do. I did them pretty religiously for the last 4 or 5 months. And came a ways, but I'm not going to be able to get that shoulder to go back like this without a lot of pain, and I'm not gaining. I'll go back here and try to raise it right there.
Show me the movements that you're having problems with.
Right here. Raise that arm. It won't go. I can't get it past. Right there.
Okay, and let's do it with your left shoulder. That's not a problem. Okay, do it one more time with your right.
Back to the back.
Okay, so what I'm going to do is we're going to do the Trigenics non-surgical operation, and we're going to work on your cervical spine, and I'm going to work on your shoulder as well. Okay, thanks. Okay, so after we did the shoulder, the Trigenics maneuver we did that on your right shoulder. So let's try to do the same movements that we did before. We're going to do lateral. Good. Go all the way up. Great. Okay, and let's try the move where you came back a little bit. That's a big difference. Yeah.
Wow.
Look at that.
Carol,
Wow.
that's behind me.
Oh my God. Wow.
He's going to have a mean
Oh,
serve.
Wow. How
You're-
painful is it to do it?
a little, but not like it was. I couldn't do it at all before.
Yeah, right.
And now it's discomfort, probably I would call it, like you've got a sore muscle, but it goes past
That is great.
past that point.
And how many visits was that?
First visit, after 2 years of having it go that high,
I'm glad I could
and I
help.
can't believe it goes past that point. So it's, now isn't it mental too, where you get the confidence that it does work again? I mean,
At this point, it doesn't matter, does it?
no, it doesn't.
That's shoulders moving. That's great. And those muscles will get stronger because they haven't been worked in a while. So once you get the weight, you're using that
No, between now.
you're going to start to feel a little bit of pulsation. And I want you to just tell me as much as you can tolerate. Right there. So what this is doing, it's charging up the mitochondria in the cells, in the muscle cells. And it's actually assisting in the tissue healing. So when I work on your shoulder, we do this afterwards, and it brings the inflammation down. Rotate your shoulder. So everything you've been doing in front of you, this muscle gets tight and short. So I'm going to release that, and we're going to do it on this side too.
Yeah, the pain seems to be.
Hi, this is Dr. Robert Davis with Active Health Complete Relief Care, and I am here with Kit. And full disclosure, this is my mother. Mom, could you tell the people basically what you were experiencing? Because I remember years ago you developed frozen shoulder, and just explain what you were experiencing, a little bit of the history of when it started.
Yeah, well, I had an injury when I was a teenager. And over the years, as I've gotten older, I've had problems with it. And then about 7 years ago, I really started having some horrible pain.
What was the injury? Was it swimming or?
It was body surfing in the ocean.
And you hit the sand?
Yeah, somebody hit me, ran into me, and I went down in the sand, and it just...
Right. And so so you didn't really have, from what I remember growing up, you didn't have major problems in your shoulder. But over the last decade, you lost range of motion in your shoulder, meaning you couldn't reach your hand behind your back or over your head. So I know that you went to other medical doctors. I believe you either went to some surgeons.
I did.
And so what have you done to try to help the problem, and then what did the doctors tell you that you would need to do?
The doctors told me, I went in, I had x-rays, MRI, that it was bone on bone and I needed a full shoulder replacement.
And how many doctors told you that you needed a replacement? Two doctors told you you needed a full shoulder replacement.
Right.
And so when you came into my office, because you guys moved down actually permanently last fall,
right,
a year ago, almost a year, a little less than a year ago. So you moved down almost a year ago, and then we started with the Trigenics with you. And I remember Stephanie, my sister, was there, and she was watching because we videotaped it. And what did you notice after that first Trigenics non-surgical operation that I did on you?
That I could reach straight up, that I could move my arm, and I've started playing golf again.
Awesome. So how would you say that has improved your life? Like what has changed since?
My range of motion and everything is kind of back to normal, and I'm not in pain, and just feel like a new woman.
And what have you started doing over the last 3 months? Where are you going with your sister?
I'm going to the gym. I joined Crunch and doing all their aerobics and Zumba and crunches and everything. And doing that and getting up and down, it's amazing.
Would you have ever attempted that before with your shoulder?
No.
That's awesome. What I'd like you to do, if you can please look into the camera. And basically, if anybody's watching right now and you're suffering with frozen shoulder, you've lost range of motion, I would like you to please give them some advice. Tell them.
I was looking at full shoulder replacement surgery, and now I didn't have to go through that with the procedure that Dr. Rob does. I'm back to normal, and I didn't have to have surgery, and it's just wonderful.
If you or a loved one are suffering with frozen shoulder, you've lost range of motion, you're not able to do the simple things that you need to do in everyday life, like washing your hair or fixing your bra strap. There's a lot of things that we take for granted, but when that shoulder starts to freeze up, you're not able to do these things. Simple hygiene becomes difficult. So please take down this phone number if you or a loved one are suffering with frozen shoulder and it's not being resolved with drugs. You're facing a shoulder replacement surgery, or you're getting injections and it's not helping. We have a special. Our normal fee is $250, but if you take down this phone number today and you mention this program, that you saw me on this program, we have a special for $60. We will do a complete neurological evaluation, and I will be able to rule you in or out of care in just 2 visits. Again, take down the phone number and give our office a call. Thank you. Hello, my name is Dr. Robert Davis with Active Health Complete Relief Care. We have Diane here this morning. Diane, thank you so much for coming on the program.
My pleasure.
And what I'd like you to do is, if you could please tell me the problem you were experiencing with your shoulder prior to finding our clinic.
Well, I had an accident at work, and it was pretty severe, which caused me to have 2 rotator cuff surgeries. And as you know, I was coming to you before because I had neck issues, and you were doing a tremendous job taking care of that.
Right.
So, of course, you knew I went through 2.5 years of physical therapy, and every time I would come in, I would still be complaining about my shoulder because I was unable to hold my right arm over my head.
I remember. My heart went out for you. And I did everything that we did at the time to try to help you.
Correct.
But then what happened is we got the training with the non-surgical operation, the Trigenics.
Right.
And so what I'd like you to take it forward from there.
And so you asked me if I wanted to try that, and I was willing to try. I was willing to try anything because I was so tired of the pain, and you can't operate on pain pills. You can't
Right.
live your life that way. It's just not right. So after our first treatment, you took a video of me, as I recall, before,
Yes.
showing me how I could only move my arm like about here.
Right.
And then it was like a miracle. I could move my arm almost to the top of my head. It was just like great. And so I did have a couple more treatments, as I recall, and
Right.
I would improve each time. I would improve,
Right.
and it would stay longer.
Absolutely.
So,
And that was, so you had, how many surgeries did you have?
2.
And then we did, and how long did the non-surgical operation on the shoulder that I did in my office, how long did that take, would you say, the whole procedure?
10, 15 minutes?
Yeah, 10 or 15 minutes. And what percentage of improvement do you feel that you got after, let's say, the first treatment compared to when before it?
Oh, I would say like at least 75%, if not higher.
15 minutes.
Yes, for 15 minutes, right. And all 2.5 years of physical therapy. Never got that before.
Right. So can you tell the camera, I think your camera's over here.
Okay.
Can you tell your camera or the people that might be watching that are suffering with a frozen shoulder, or maybe they have postoperative pain like you've had, or they're getting injections, they're taking pain pills, and they just don't think there's any other solution. Could you just give them some advice?
Well, I would certainly call you. I would certainly write down the number, because I did not know there was anything like this out there before you told me about it. I thought that I was doomed for the rest of my life to be having this pain. I tried injections. They did not help it. Not one bit. Not one bit did those help me. Pain pills, like I said, you really can't drive on pain pills, so what quality of life do you have? So I would recommend that you pick up the phone, leave a voicemail message. Do it right now. It doesn't matter. They'll call you back.
Thank you very much, Diane.
No problem.
So if you're a loved one or suffering with chronic shoulder pain, frozen shoulder, you've lost range of motion in your shoulder, and you're taking the pain pills, you're getting injections, you're facing, having a whole shoulder replaced, please take down the phone number below. We have a special right now for $60. We will conduct a complete neurological examination, and I will be able to rule you in or out of care within 2 visits. Again, please take down the phone number and give Becky a call at the front desk, and we'll get you scheduled as soon as possible. Thank you.